Вітаю.
Hello, dear colleagues. It's the 198th day of the heroic fight of Ukraine, and we started a series of our briefings at the Media Center Ukraine. Today we have the representatives of the region who will be speaking about the new wave of coronavirus coming to the Lviv region. So I would like to give the floor to Orest Chemerys, Director of the Healthcare Department of Lviv Oblast Military Administration. So could you please tell us about the situation with coronavirus in the oblast? Good morning, glory to Ukraine. Yes, it is really so that we are heroically fighting against the aggression of the Russian Federation, and we should also state the fact that since the beginning of the military aggression, the coronavirus did not go away, and as of today, we have been witnessing the growth of incidence of coronavirus disease. And in the last 2 weeks, the incidence has increased by 25% in comparison to the previous 14-day period. At present, almost 270 people are treated at inpatient facilities, and we should state the fact that within the last 5 years, the number of cases has increased. But at the same time, we are witnessing that many people with the signs of coronavirus infection have a mild course of disease, and they only have some mild signs, mainly affecting the upper respiratory system. So the number of people hospitalized is not that high. People who need inpatient treatment include mainly elderly people, people with various concomitant diseases. Coronavirus just aggravates the other diseases that they are suffering from, and that is why they will seek medical help. And coronavirus is the factor which provokes their hospitalization. We have been witnessing the growth in the incidence numbers for the last 6 weeks, but the situation is under control. And considering the fact that we have started the new academic year, and considering the fact that we are quite conscious of the fact that the contact in educational facilities, well, schools, vet schools, and universities will increase, we understand that the number of people who get infected will increase as well. So, taking into account all the limitations connected with the quarantine measures, we should not exclude the possibility of the situation that we should stop recommending implementing certain measures and start implementing them and making them mandatory, because COVID is still there, and we see that the autumn period is the period when we usually have the increase in the incidence of respiratory diseases. So I would really recommend you to remember that COVID has not disappeared, and that we should take care of ourselves. We have to remember that any mass meetings of people, especially in small rooms, are the factors which could cause the increase in the incidence of the disease. And we have already mentioned that this is 198th day of our war, so we have to take care of our health so that we can fight for our victory. Thank you, and I would like to give the floor to Natalia Ivanchenko, the head of the Lviv Oblast Disease Control and Prevention Center of the Ministry of Health of Ukraine, and also Epidemiology and Vaccinal Prevention expert on the healthcare department of Lviv Oblast Military Administration. Could you please tell us about the situation in comparison with the previous years? Glory to Ukraine. It's raining in Lviv today, and it's a little bit colder today, and that means that the number of people who will feel under the weather today will be bigger today. And there's a risk connected with coronavirus. In line with coronavirus, we also have adenoviruses and also flu virus, which will also circulate among the people in the region very soon. What does it mean for ourselves? In the previous years, we had COVID-19 pandemic, which actually well, brought the whole world to a halt. We stopped flying, we stopped going to school, enterprises and organizations stopped operating on site. And we really hope to prevent the situation now. COVID-19 has become a seasonal disease. The researchers expect for COVID not to disappear, but to stay with us. It's just that the incidence rate will not cause any disruptions for our work and the work of various organizations and institutions. What we see today is the increase in the disease incidence rate. Yes, in the last 6 weeks, we have been witnessing growth by some 20 to 40%. Well, last week we had the increase by 20%. 16,000 cases of COVID in Ukraine in the last week, and about 200, these were people in Lviv region. Well, five serious cases, and the share of children is very little in this regard. Out of 16,000 of people with COVID in Ukraine, we have 2,000 children with COVID. But we have a very clear correlation. Those who are suffering from COVID, these are people who are unvaccinated or had only one dose, or those who have been vaccinated more than 6 months ago. What does it mean? It means that vaccination is effective and it really protects people from serious forms of this disease and from grave courses. But those who have been unvaccinated require protection, and we believe that the protected are those who have received 2 doses of the main vaccination complex. And I should say that in the Lviv region we have more than 1,100,000 people who have received the first dose, and approximately the same amount of people has the same number of people have received a second dose. Well, those who have done the second dose more than 6 months ago, they need to do this booster. And we have 123,000 people in the region who have this booster dose of vaccine against COVID-19 administered. People with chronic diseases, with immunodeficiencies, they need to get the second booster dose administered in 4 months after the first one to reinforce their protection. At present, about 400 people have only received the second booster dose, and that means that each resident of Lviv Oblast should think whether they would like to be in hospital with the diagnosis of COVID-19 or whether they would rather be protected by the vaccine. We have the vaccine in the Lviv region. We have CoronaVac vaccine. We have Johnson vaccine. We have Pfizer vaccine, but it's not available in all facilities. However, we expect to have it in more facilities in the nearest future. And I should also note that most actively we've vaccinated the young people aged from 25 to 45. So these people really understand that the best way to protect yourself from this grave disease is to vaccinate. And I would also like to draw your attention to the fact that we have the Omicron version of COVID at the moment, and it has the mildest clinical forms of COVID-19. But the virus keeps mutating, and what we have right now, it's a little bit different from what we had in spring. According to the lab results, which are done in reference laboratories of the Public Health Center, Public Health Service of the Ministry of Health of Ukraine, we have the Omicron BA.2. In the majority of cases in Europe and in the US, almost 60% of cases, this is the Omicron BA.5. We don't have it in the region yet. I'm saying yet because the migration processes keep occurring, and there is the danger of having this strain. So if you go to a healthcare facility to visit a patient, please put on a mask as soon as you enter the premises. If you see a person with the signs of a respiratory disease, please put on a mask to prevent being infected. If you feel under the weather, please stay at home and inform your family doctor, and then the family doctor will tell you what to do. If you are ill and and you need to leave your home, please put on a mask so that you prevent infection of people surrounding you. If your child has some signs of a respiratory disease, don't let the child go to a kindergarten or to the school. Don't pose the danger to other children, even if it's not coronavirus. What concerns the study in organized groups of people? When we have many people together during the breaks, during various mass events, it is recommended for them to put on the masks. It includes also the students of universities. The more people are in the room, the higher is the risk to spread COVID-19. These are recommendations. The choice to stay healthy or to get infected is yours. So I wish you good health, be wise, well, and protect yourself and your environment. Thank you. I would like to give the floor to Orest now, and we have a question. So you said that there's not enough Pfizer in the region at the moment. So when can we expect more in the region? Well, at present, we have enough Coronavac vaccine, we have enough Johnson vaccine, and according to all orders and recommendations of the Ministry of Health, they are replaceable. So those who would like to get a booster dose, if we are talking about booster dose, which is really necessary, so anyone who wants to get it, they can come and get this vaccine administered. What concerns the next batch of Pfizer to Lviv region, we expect to receive it within 70 days. So what are the doses? How many people in Lviv region can expect and can get vaccination after the new delivery? Well, we will have enough doses of vaccine. So this may be frozen vaccine, or this may be vaccine which will be ready to be administered. So we, as a Department of Healthcare, we calculate what are the needs in the vaccine, and the number of doses will be enough. So we will make sure that no resident of Lviv Oblast will feel the lack of vaccines. And I would like to remind everyone in the room that you may ask questions if you have any. If you do, please raise your hand. I have a question. The city recommends to go back to wearing masks. What do you think should be done? What measures should be taken to prevent the spread of coronavirus? Should we wear the masks? Well, before the beginning of the academic year, as the main sanitary doctor of the region, I sent a letter to educational facilities reminding that the measures which have been stipulated by the order of the main sanitary doctor of Ukraine, it pertains to wearing masks during the study process, especially during the recesses and when holding events with many people. Well, parental meetings are prohibited. They can only be done online. If parents need to enter the schools, it has to be agreed upon with the management of the school. And the same recommendations pertain to healthcare facilities in the region. So it's necessary to wear the masks there. It's necessary to examine people with any signs of pneumonia or respiratory diseases, isolation of patients, logistics of hospitalization. And Orest has already stressed that there are no mandatory measures. All these things, they are recommendations, and we expect the residents of Lviv Oblast to be conscious enough to prevent the aggravation of the situation. And I would like to add that while being in bomb shelters, if there are many people there, we have to remember, especially when we talk about educational facilities, that it's better to wear masks there. In the conditions of the martial law, the number of vaccination points have been decreased. So where will people be able to get vaccinated, and how does is the region preparing for the new wave? When we talk about vaccination, it's quite accessible. In connection with the martial law, we do not practice opening vaccination centers in the places which are highly visited. if we talk about Lviv, some vaccination points were organized in the malls. Considering all the security measures, these centers cannot operate there anymore, but we have primary healthcare facilities, so the patients can go to polyclinics, to outpatient treatment facilities, and in all healthcare facilities we have the vaccination offices. So a person who needs to get vaccinated, who wants to get vaccinated, they can address their family doctor, or they can go to the nearest outpatient treatment facility and get vaccinated there. What concerns the readiness of the system to the next wave of coronavirus disease, we are very serious about that, and we have been thinking about that throughout the whole period of martial law. And well, the role which is played by the healthcare system at the moment should take into account the possible load which may be connected with the next wave of coronavirus disease, especially if we have many patients who need inpatient treatment. All healthcare facilities have enough well, well, equipment. They also have the reserves of oxygen, and for the period of the martial law, a significant number of healthcare facilities have added new oxygen stations, which have been procured at the expense of the Ministry of Health, and they have been distributed among the healthcare facilities in the region. So we are ready, but we really hope that our understanding of the situation and the fact that we have already gotten used to live with coronavirus, and we have been living with it for 3 years, so we will be taking the preventive measures, and we will still follow the recommendations despite the fact that they are just recommendations. Thank you. This was Orest Chemerys, Director of the Healthcare Department of Lviv Oblast Military Administration, and Natalia Ivanchenko, Head of the Lviv Oblast Disease Control and Prevention Center of the Ministry of Health of Ukraine, Epidemiology and Vaccinal Prevention Expert of the Healthcare Department of Lviv Oblast Military Administration. And we'll meet at 10:30, and we'll speak about the new